Today on Community Watch, we will have Kurt Stuenkel join us, who is the president and CEO of Floyd Medical Center. We'll be getting a COVID update, but also talking about new heart-related programs at the hospital. So stay with us. Community Watch starts now. Welcome to Community Watch. Greg, how are you?
Fine, brother. And yourself?
Okay, I'm okay. I'm good. I'm getting to know my home study so much better than I anticipated I ever would.
But it's nice there, so I'm sure you got things to do.
Well, there were a couple of books that I hadn't gotten to yet, so I've been able to get to them. So, and I know you've been reading too.
I have just actually bought the Color of Law.
Oh, I have that one.
I think it's the second time I purchased it, but yes.
Well, we'll have to talk about that on a future show.
Yes.
But today, we are thrilled to have back with us Kurt Stuenkel, who's the president and CEO of Floyd Medical Center. Welcome back, sir.
Thank you. It's a pleasure to be back with you guys.
I know that there are developments, as I guess there always are at Floyd, that you want to cover on today's show, but it seems like we probably need an update on COVID and the virus and where we are and where y'all are right now, because I know not only in Georgia but in many states there's been a surge in positive cases.
Yes, thankfully in our neck of the woods, our numbers are relatively low in terms of patients being hospitalized. We continue to do more testing, and as Dr. Gary Vocio, our public health director, will tell you, that the coronavirus is still around, but our rate of hospitalizations is down. Now, in other areas of the country and the world, it's quite the opposite case. In Arizona, in Texas, in California. And then I was just looking at an article this morning, south of the Rio Grande, you go all the way down to the tip of South America, coronavirus is raging. And in many of the countries, they just really are fearful they will be overwhelmed. And it relates, according to this article, it relates quite a bit to the fact that a lot of communities live together, there are high rates of poverty, and so the coronavirus, it's just a breeding ground for the coronavirus. And people are fearful of this occurring in India as well, because there's a lot of income inequality in India as well, where there are rich, a lot of poor, maybe not so much middle class, and people live in congested conditions. That's perfect breeding ground for the coronavirus, and who knows what's going to happen. We also, I've heard multiple physicians now saying, and some in the public press as well, that perhaps the coronavirus is mutating and changing. And, in different areas, it may be more severe, or virulent is the word that they use, and maybe less so in other areas. So who knows? I mean, we're still learning so much about the coronavirus and COVID-19. And I think the bottom line is we've all got to continue to be vigilant, practice our social distancing, wear our masks, wash our hands, don't touch your face, all of those things that all of us, each and every one of us, need to do.
I have seen, just traveling through downtown in Rome, really very few individuals wearing masks, and that does concern me.
Yeah, I've seen the same. We just had a teleconference here at Floyd talking about the need here for all of our coworkers to continue to wear masks, and our chief medical officer, Dr. Ken Davis, was making the same comment about what he's seen in grocery stores. You know, that folks just they're getting more lax. And I saw in the press this morning the number one tennis player in the world, Novak Djokovic, decided to put together a tournament in his country. They were nobody at the tournament was practicing, you know, any of these necessary things. People were sitting shoulder to shoulder, the fans, and, you know, lo and behold, 3 or 4 tennis players got it, fans have gotten it, and they canceled the tournament. And so, you know, those things are worrisome. The virus is still out there, and we need to not let our guard down.
Kurt, do you believe part of that is in part due to, I'm going to say, confusion on the part of the public? Because it seems to be 2 different narratives out there. You have one where it's like, you know, we've over it, the curve is flattening, we're going to decline. But then at the same time, we have other health professionals that are saying, you know, we still need to be practicing social distancing. But it seems like there's 2 different competing narratives that is being put out that can be very confusing.
Oh, I think you're right, Greg. I think, well, and I think you got to add to that too, people getting weary. They're getting tired of all of this, and they're desperate to get out and resume their normal lives. And they see that, you know, the numbers are going down, society's opening back up. I think people just long for things to be like they used to be. And I think the public health officials and others, we need to keep encouraging people to be cautious. And these big, giant public events, you know, they worry me. I mean, I know the president, you know, he had his big event in Tulsa. You know, he wants to go out and campaign. I'm not sure that's a wise thing to do, to have big public events yet. I worry about these sporting events. You know, I just talked about tennis. You know, they had a bad outcome. They had to cancel the tournament. We may be doing some things too early.
Now, I know, Doc, unless you have any other questions about
Go ahead.
COVID-19, I know Floyd is in the process of, I guess, seeking a certification or certificate of need for heart surgeries. So where are you at in that process now?
Yeah, we are in the middle of that process. So we filed for a certificate of need 2 years ago, and it's gone through a process of review and then appeal and then another level of appeal, and that takes time to go through that process. And 2 or 3 months ago, we actually exhausted all of the levels of appeal through the state system, and we took it to the court system. And we took it to the Fulton Superior Court, and it was in Judge Bryant Durham's courtroom where we made the case that we thought that the state had made errors in reviewing our application. And the judge listened to both sides. He listened to the state's attorneys. He listened to our attorneys. And then he found in Floyd's favor and said that he thought that the state had, in fact, made errors. They didn't apply the same standards in reviewing our application as they did some others. And he sent it back to the state. And said, you need to reconsider this. In fact, he called the state's ruling arbitrary and capricious. Those were his words. And so now it's figuratively, actually literally, sitting on the desk of the commissioner of the Department of Community Health. And as we are in this time period, Floyd, here at Floyd, we decided we wanted to do some more intense lobbying of our case, if you will. We put together a brief 5-page description of our rationale. We've placed a lot of phone calls with people that know officials. And then we also did a grassroots campaign that we just announced last week. And in our grassroots campaign, we've asked the community to get involved and to sign an electronic petition. And we're over 1,700 people that have signed that, and over 500 comments, people expressing their desire that Floyd be granted this certificate of need.
Now, just so everyone is clear, why did you pursue that avenue from the beginning? Like, why did Floyd decide he wanted to get into the, I guess, heart surgery business?
Well, you know, I'm not going to deny that there are business reasons. There are business reasons. We want to be a comprehensive provider. We want to be competitive in our range of services. But our rationale for applying was that we took a real close look about 2.5 years ago at the statistics in our region. And we were actually doing this as a result of, my knowledge of recent initiatives that the American Hospital Association was encouraging all hospitals in the nation to do. And they called this the Equity of Care Project. And they said, take a look at the services or in the service area, the communities that you take care of. Take a look at disease incidence and mortality rates by all the demographic criteria, by age, by income, by sex, by race, by ethnicity. Take a look at it and see what it shows. And we are confident throughout the nation that it's going to show different levels, disparities of care, disparities of access. And, that's been well documented throughout the nation. I mean, there are diseases that certain people get. I mean, just pick one that's obvious. I mean, breast cancer is more prevalent in women than it is in men. Sickle cell anemia affects African Americans more so than any other race. I mean, those types of things are evident. There are also income disparities. The lower the income, the higher the rates of obesity and diabetes and that type of thing. And so as we looked at our data, we discovered something that we really weren't aware of to this extent in our multi-county service area, which is Floyd and the counties around us. And that is that the rates of death from cardiovascular diseases for African Americans were much higher than the state average, and much higher rates of death for African Americans in other places in Georgia. And we said, oh my goodness, we really weren't aware of that. And at the same time, the state of Georgia was opening up the doors to say, well, we want to receive applications from interested hospitals for open heart surgery. And we said, this is an opportunity to show that there's a lack of access to care for African Americans, and we think that justifies approval.
That's interesting in the sense that we know that African Americans die from more treatable and preventable diseases than anybody else, and we know a lot of those are underlying reasoning. But I don't know that we are talking as much about cardiovascular. I know that's not a conversation that I'm normally having as well in my own circles. And the fact that we are dying, not just African Americans, but people are dying at a high rate of cardiovascular disease, clearly we have to have more conversations around that killer, because it is killing a lot of people, and African Americans a lot. And how do we start those conversations? Where do we begin having those conversations?
Well, what we were pointing out in our application is we absolutely are not saying anybody is discriminating. We don't believe that to be the case. They're fine doctors, and Redmond's a fine hospital. But our point is there needs to be outreach. We need to go out to where people live and worship and congregate and talk to them and engage them. And that's lacking. That doesn't exist. And in fact, our point is that our competition, Redmond Regional Medical Center, has had this program for 30 years and literally earned hundreds of millions of dollars in profits. And they haven't addressed any outreach. They're treating the back end of the disease and doing nothing to devote resources to help people not get in that kind of condition. And that's what needs to happen. It's a complex situation. I mean, there are lots of factors that cause people to get cardiovascular diseases, but there absolutely needs to be outreach. And that's what Floyd intends to do.
We're coming up on our break in just a few seconds here, so this seems like a good place to stop just for the moment. But we will be back with our guest and lots more to discuss right after this, so don't go away.
Your life is filled with opportunities to show the world you can take charge. It's waking up each day with a mission. It's working each day toward a goal. It's choosing to rise. It's charging forward with a purpose. It's changing the course of your life. and taking charge of your future. If you're ready to be a Take Charger, enroll at Georgia Highlands College today.
Welcome back to Community Watch. We're having a conversation with Kurt Stuenkel, the president and CEO of Floyd Medical Center. Did I understand correctly that African Americans have more cardiovascular issues in this part of the state than other parts of Georgia? Was that correct?
The rates of mortality are higher here than in other parts of Georgia. Yes, John. But in all of Georgia, it's higher than it is for Caucasians. Yes.
I'm just wondering what it might be about this part of Georgia that the mortality rate would be higher than elsewhere.
Well, that's a great question, and I don't pretend to know the complete answer to that. It's probably multifactorial. There's as we've talked to others about our application, they've said, well, you could also say that income. If you looked at the data by income, I bet you that rates of cardiovascular deaths would be high too, and I'll bet they're correct in that question and that potential observation. Diet, exercise, income. Access to healthy foods, knowledge as to how to eat in a healthy manner. My wife works with the community kitchen that's on North Broad Street, and she's done that for a number of years, and that's a fantastic outreach. They serve meals Monday through Friday. Churches volunteer. They come in. Anybody that shows up gets a meal. They cook about 150 meals a day for folks. And anyway, she made the observation that they provide healthy foods, but a lot of low-income individuals of all races, the food that they access is inexpensive food, which is food that's good, satisfying, but it's high in fat. It's fried chicken, it's hamburgers, it's French fries, it's onion rings. All the stuff we all like to eat. But if you eat that all the time, it's not good for you. It'll kill you. You need a balanced diet, and so a lot of these things are interrelated.
Kurt, I want you to talk about, from what I gather, what you were saying is the whole kind of premise of your application was lack of outreach. So with that in mind, what does Floyd have in mind in terms of what does outreach look like? What's the goal? What's the plan for that? Yeah,
that's a great question, Greg. And we don't have that completely designed yet. And I think, in fact, that's a good thing. We don't have it completely designed, because one of the guiding principles is going to be, we want to reach out to the people that we intend to serve and involve them. And so we want to partner with people, where they live, in the churches, in the schools, places of employment, social gatherings, fraternities, sororities, 100 Black Men in Northwest Georgia, all those kinds of groups to help us to do the appropriate outreach, making partners, of all of these organizations so that we can put this together effectively. And I want to add too that, it was announced last November, and we're still working on it, that we're joining with Atrium Health out of Charlotte, North Carolina. Atrium Health is one of the leaders in doing this kind of outreach. And in fact, that's one of the reasons that I was really attracted to Atrium Health when we were looking at who Floyd might join. And we're looking forward to learning everything that they do. And I think they're going to bring us expertise in having done this kind of thing through a lot of years. So looking at who's doing it well throughout the nation, engaging, making partners of the organizations that we wish to serve, to get to people. Those are going to be sort of how we get started.
And what would you say is the timeline, anticipated timeline for getting some of the outreach going and actually being able to perform these surgeries?
Yeah, a great question, John. They're actually separate. And so as it pertains to our certificate of need, we may get a decision on that, within a week or two. However, there was a 30-day extension last time. We thought we were going to get a decision the end of May. And then the commissioner wrote another ruling, said it'd be the end of June. He could do that again. We hope not. We think it's time to make a decision. And if we get approval, then we'll start to work on designing our facilities. We're going to have to make some additions, so we'll have to talk to our architects, design the space. You know, that's probably going to be a period between design and construction of up to a couple of years. We'll work with the Harbin Clinic cardiologists and cardiothoracic surgeons and putting the program together. And so, you know, that's what that timeline looks like. If we get disapproved, we still have appeal rights. We'll have to evaluate that. As it pertains to these outreach programs, we're going to do these outreach programs whether we get ultimate approval to do cardiac surgery or not, because they need to happen. And we're going to have even more resources than the considerable resources that Floyd already has once we join with Atrium. As a part of our Atrium transaction, when we come together, we're going to get a sizable contribution to the Floyd Healthcare Foundation, which is affiliated with us. And annually, we're going to have funds to help supplement and put together these programs as we look to not only create, but to partner. And so we've got, I would imagine, about a year's worth of work to put all this together. But in the meantime, we're going to see what we can do on a short-term basis as well. So we will begin that activity, you know, even as we speak.
You know, when you talk about it, it seems so simple, but outreach we know is prevention. It's all about prevention, and part of prevention is education and awareness. So the lack of education and lack of awareness is just something I think as a society we have to do better when it comes to health. But particularly in this area in which we live, we have Floyd, Rome and Floyd County is considered a hospital mecca. You know, you have all these great partners, you have all these great institutions, but yet I know personally, I can say there's a disconnect between the access and the community to some degree, because I know in some of the work that I do and me and John, we do, there is a lack of access and understanding of how to access the top quality that we have. No one can deny we have top quality healthcare here, but making sure that everyone in the spectrum is aware of that is something different. And so I definitely think this conversation, regardless if y'all get the certificate or not, definitely is going to change the conversation about outreach in Floyd County.
Yes, I think you're right. I mean, there's no magic wand that we can wave and fix everything. I mean, it's going to be difficult work. These problems in access and different outcomes by, you know, all these demographic criteria, age, income, sex, race, these have emerged over a long period of time. So there are lots of reasons they've occurred, and it's not a wave a magic wand to create a program and you solve it. I mean, we've got a lot of work to do. But the good news is that we're going to get about it, and we're going to have resources to bring to the table in order to put it together. I do want to add one thing, since, you know, I mean, I am talking to you guys, and there are folks in the community going to watch this. There are folks that have criticized Floyd's grassroots approach and have said that we are accusing Redmond and even some doctors of being discriminatory, and we're accusing them of being racist and you know, not taking care of African Americans, and that's just absolutely not true. I mean, what we have done is that we pointed to the statistics, and we said the statistics are there. The statistics are true. They're true not only here, they're true throughout the nation. What we need to be about is addressing the problem. And so there hadn't been outreach. We want to do outreach. Redmond does a good job. I know the doctors there. One of the surgeons who's just retired did surgery on one of my relatives, did a marvelous job. I mean, we're not talking about that. I mean, what we're talking about is the rates are there, the numbers are there. We need to have outreach services. That's our point.
You know, I'm thinking about the community outreach aspect, but also just wondering what it is that makes people generally, but maybe especially in this area, so reluctant to pay attention to wellness information. And I know the 100 Black Men of Rome, Northwest Georgia, have their event annually, the HIM event, although the name has changed over the years.
Yes, him plus.
HIM Plus, which traditionally is in August. Is it in August this year too?
But tentatively, we're still planning to have one in August.
Okay. But I know that's a
Tentatively.
day where individuals, I mean, there used to be, and I guess there still is a focus on men, but I know they're open to men and women, anyone, to come in that day to be tested on a broad range of health areas. And that's just one event. But, you know, when you think about the reluctance of people to wear masks in the COVID crisis and to just take better care of themselves, even though the evidence is pretty clear, I don't really understand why people aren't more attentive to wellness issues. And I don't know if I don't even know if I've asked a question, but that's just something that I've been thinking about.
Yeah, well, you're right. I mean, it's a complex issue, and heck, I'm as prone to making bad meal decisions as anybody else. You know, I try overall to eat well, but you know, sometimes that piece of chocolate cake is kind of tempting. You know, and you know, I've heard people say every now and then you can cheat, but overall you need to have a good diet and you need to exercise. So you know, I think it's a discipline, and it's what people have to learn how to do.
You know, but also I think what you and John both have said is true, but also I think this is where outreach come in, having healthy programs, especially for children, having outreach programs that encourage healthy lifestyles, healthy activities. And I think in Rome and Floyd County, we lack that besides organized sports. I just don't know with the camp that we do, foundation camp, health is a part of that. And I think creating more opportunities for the community to engage in healthy alternatives is definitely something that is needed and can be done in this area. But I just think it has to be a community-wide approach. I think it's easy for people to start small groups and that peters out. But I think if we had community approaches, I think you can encourage more people to get involved. We know through the 100, through our HIM, the number of Black men that get tested annually for prostate, we know that number has gone up over the years. And we know those are conversations people are having. So I do believe outreach can work. It just has to be a concerted effort and a consistent effort, I think, on those that have influence and resources to bring those about.
Yeah, I agree.
Well, I know we've only got a minute or so left. So the prospect of adding cardiovascular and heart surgery to Floyd and to have any additional option of health care to the area is pretty exciting. It looks like y'all have been working on this for a long time, so I know you're anxious for it to be resolved.
Yeah, well, and competition's a good thing. In fact, the Redmond administrator said that when they applied to deliver babies. Competition's a good thing. Well, if competition's a good thing for babies, competition's a good thing for surgery, open heart surgery. And we think we can do a quality program. We've done quality everything we've done. So we're hopeful we get approval.
Well, thank you so much for being with us, and I won't be surprised if we ask you to come back again real soon.
I'd be happy to do it. It's good to talk to you guys.
And thank everyone for being with us. We'll see you next time on Community Watch.
Very good.